Today, an award-winning quality improvement project that standardized comprehensive biomarker testing in patients with metastatic non-small cell lung cancer. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This summer, Cancer Buzz is highlighting winners of the 2023 ACCC Innovator Awards. The ACCC Innovator Awards showcase cancer centers that are improving cancer care delivery and the patient experience. Today, we learn how Oncology Hematology Care, or OHC, increased biomarker testing rates for metastatic non-small cell lung cancer from 68% to 93%. Molly Mendenhall is a registered nurse and Director of Quality and Compliance at OHC in Cincinnati, Ohio.
The primary goal of this project, right, with metastatic non-small cell lung cancer patient is we know that every patient deserves to get tested, but unfortunately with biomarker testing, not every patient does. So we know nationally, right, that testing rates are usually about less than 50%. But with the shift towards personalized medicine, if we could properly, implement and standardize this across our practice in the nation, this can really provide, targeted therapies, which are proven to improve that overall survival rate and quality of life. So this project really looked at standardizing that across our practice for our physicians to make it as streamlined and efficient as possible, right? With the overall goal being really with new advancements and knowledge in the biomarker space to really increase that hope in the cancer patient population.
What are the costs to patients and the practice? And how is the testing reimbursed?
Yeah, so the great thing about this project is that you can implement this for no cost. So that's a really great thing about this being scalable and reproducible, not only in the non-small cell space, but actually we also did it in the breast cancer space as well. And now we've been rolling it out with McKesson and the US Oncology Network across the entire nation. So you could implement this with an ROI of $0 by creating standardized templates and order sets to help process efficiencies with your physicians at your clinic. The great thing for the patients is we had no financial implications that showed, increased costs for the patient. We didn't have denials for their biomarkers. We were able to successfully, implement and biomarker test about 93% of our non-small cell population in 1 year.
What kind of impact has this project had on OHC?
OHC was really able to prove, right, first in the genetic testing space with our breast cancer patients, for example, that, with education, standardization, and an error-proof system, that this process really is scalable across not only cancer practices, but also reproducible in those other cancer, disease states. So, I think with a few simple standardization techniques at your, potential clinic, you could mold this perfectly into physicians' everyday workflow. And we were really able to prove that, right, with our testing results going from, somewhere in that 50 to 68% range to 93% internally with just a couple small tweaks.
How can other cancer centers start similar programs in their own clinics?
This standardization, which has a very high impact on overall patient quality, survival rates, is very easy to streamline and roll out. I think for these type of projects, you really just need that internal approval and support from, perhaps your leadership team or your board of directors, if you will. But really that buy-in from physicians and leadership, really with that collaborative approach, you can very easily streamline and roll out these operational efforts and clinical efforts with little to no cost internally. And you can see, the success from that buy-in really, helps improve that overall patient care and patient outcomes.
Mendenhall and her colleagues will be at ACCC's 40th National Oncology Conference this October to present Oncology Hematology Care's Quality Improvement Project that implemented and standardized comprehensive biomarker testing in patients with metastatic non-small cell lung cancer. You can find a link in the show notes to register for that event held October 4th through the 6th in Austin, Texas. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.